Sadly, of those in hospital, 12,107 people have now died.
Another day, another politician standing at this lectern with bad news to tell. But today, away from this room, new figures published by the Office for National Statistics shed more light on just how abnormal these times are. The pink line on this graph shows how many people die on average in each week of the year. The blue line is 2020's figure, but just look at what happened in the week running up to the 3rd of April. An extra 6,000 people died in England and Wales.
When it came up with this huge spike for this week in terms of the total deaths, not just the COVID deaths, I was personally very upset. I don't think I've ever been quite as moved and as shocked at data being portrayed before. And I'm a statistician, I look at data all the time.
Of those 6,082 extra deaths, 3,475 mentioned COVID. 2,607 didn't. One possibility is that COVID deaths are simply being missed.
The big question is, why would deaths go up which are not labelled as COVID? And the first one I think that people would come to is that maybe these are associated with COVID. At the moment, the Office for National Statistics reports that less than 10% of COVID deaths are out of hospital in care homes or at home or in hospices. Maybe that figure is a lot bigger, but doctors have been not putting COVID on the death certificate because the patient won't have been tested, so they can't be confident about it.
But there are other troubling theories too. Remember this?
If too many people become seriously unwell at one time, the NHS will be unable to handle it.
One explanation raises the spectre that this colossal attempt to protect the NHS could be having an unintended and detrimental impact on medical care more generally.
So, of course, as you'd expect...
This is Ron Daniels in normal times. He's an intensive care doctor in the West Midlands, and what he's noticed is a worrying trend.
Normally in my day job as an intensive care consultant, I would expect to see at least a patient a day referred to us with sepsis. In the last few weeks, I haven't had a single referral of a critically ill patient with sepsis, and that's alarming. Where are those patients? Many health professionals I've spoken to are really worried that people are suffering in silence. They're staying at home, they're deteriorating, they're ignoring their symptoms because they're fearful of going to hospital, because they're fearful they might contract COVID-19, and they're fearful that might be a death sentence, which of course is not true.
There may be a significant number of people not turning up at healthcare, which is what we're really concerned about, and seeking out because they're really scared about engaging with healthcare right now. Put that all together, and the size of the excess, you've got a significantly concerning issue that's happening right now.
If we look again at the graph showing the spike in the most recent deaths, the blue line shows that for much of this year, deaths were actually below the 5-year average. Some believe that could be important too.
If you go back to 2017-18, there were 50,000 excess deaths in that winter alone. Come to this year, and we've had quite a mild winter. The weather's been good. We haven't had a significant influenza outbreak. The vaccines seemingly work. So in the last 8 or 9 weeks, we've been trending very much under. And that means a significant number of people who are vulnerable, who are elderly, who are frail, might be in a position now when they get hit by the COVID, they're very susceptible to it.
There's a lot about the effects of coronavirus that we just don't know. We still don't know the true extent of how badly care homes have been hit, for example. But perhaps one of the areas we know least about is how this unprecedented lockdown is affecting the general health of our nation.
James Clayton, well, if much is as yet unclear, one government pronouncement was cast iron. The Health Secretary, Matt Hancock, told us that by April 30th there'll be 100,000 tests a day. That would surely inform decisions on the lockdown. We're just over 2 weeks away from that deadline. James is here again. Where are they with testing?
Well, one of the interesting figures that came out of that briefing today was that yesterday the government carried out 14,900 tests. Now, we plotted that, tracked that from the last week, and essentially the government hasn't done that much in the last few weeks, now, or in the last week. Now, you might expect considering their target's 100,000, for them to have made a bit more progress than this, but they haven't. Now, one senior NHS source told me today that this is all about the antibody test. If they can make that work, they can scale that up quickly, but at the moment that antibody test isn't accurate enough. Now, obviously, testing is key to ending this lockdown. Boris Johnson said he wanted 250,000 tests last month, but at the moment we're simply nowhere near that. And I think if the government is going to hit this 100,000 target, in the last couple of weeks it's increased the number of tests by a few thousand. In the next couple of weeks it's going to have to increase it by 85,000, and that's quite a task.
85,000, of which how many would be expected to be the test for the existing condition and the test for the antibody?
In terms of the antibodies, right now, as far as we can see, there is no antibody test. In terms of all of those figures that you've just seen, they do not include antibody tests.
Thank you very much indeed. Well, we did ask for a government minister tonight, but none was available. I'm joined now by the former Conservative Health Minister, Philip Dunne, and by Dr. Clare Wenham, Assistant Professor of Global Health Policy at the London School of Economics. Thank you both very much for coming. Clare, can we just begin on that question of testing? In your assessment, is the government going to be able to hit that promise in 2 weeks?
I just don't know how they can. I think my main concern is, and following the montage that we just had, is that that is nowhere near that number yet. And we don't simply have the same infrastructure and laboratory capacity as some of the countries which are really leading the way in this, like South Korea and Germany. So I hope they can, but I'm not hopeful that they will.
Well, Philip Dunne, just coming to you, the problem with that was so much is uncertain, but it was an absolute promise by Matt Hancock. What do you think the chances of delivering an 85,000 increase, daily increase, in 2 weeks' time?
Well, I agree with Clare that we start in a very different place to a number of other countries with limited laboratory capacity in this country. And what is happening, the government are putting enormous efforts into generating additional testing capacity. And we've got these super labs which are will be capable of conducting tens of thousands of tests a day. It's just starting to come on stream. So I understand that Manchester opened at the end of last week.
But not with an antibody test.
Well, the two types of tests. The 100,000 included all types of testing, including the swab test to see if people currently have the disease, and that is what will be happening initially. There's Manchester, there's Milton Keynes is the one that came on last week. Manchester and Glasgow are coming on stream in coming days.
So, Clare, if I could just talk to you about what the promise, the strategy and so forth that you would have liked to have seen the government pursue until now.
Well, I don't know why the UK government haven't been listening to the guidance coming out of the World Health Organization. Dr. Tedros was very clear that it was test, test, test. And the countries that we've seen getting out of this situation and the lockdown sooner than others, or in fact never going into a full lockdown, they followed a very simple strategy of testing, isolating those who are infected, and then contact tracing who they've been in contact with.
Well, Philip Dunne, in a way, what Clare is saying is we almost had, I would hate to call it a luxury, but, we had, 10 or 12 days where we could watch other countries, South Korea, Taiwan and so forth, and inform our policy from them. But we didn't do that early.
Well, I think that's not right. We've been looking to develop the tests ever since it became clear that this pandemic was going global. Some countries have undertaken different measures to us at slightly different timescales. Some of them are seeing a second peak. So Japan has gone into a second phase of lockdown, I understand. I think the critical issue here, as Clare was saying earlier, is the antibody test. There is, I understand, some laboratory testing of antibodies going on at Public Health England's lab in Porton Down, but there is not yet a commercially viable antibody test available in this country. And Clare can correct me if I'm wrong, but I'm not sure it's available in any other country. And until that is available, we're not going to be able to tell who's had the disease, and that is going to have an impact on our ability to relax the restrictions.
Yeah. Well, that kind of brings us to a possible exit strategy. The government claims tonight, it was a request for information on that exit strategy or possible exit strategy from Keir Starmer, the Labour leader. The government claims tonight that it cannot lay out the exit strategy because the critical message is that people have to stay at home. So you can't have both the exit strategy and the message people have to stay home. But I put it to you that that actually is a bit patronising, given that there's been a 90% adherence to both social distancing and to isolation. So why can't we trust the public with information?
I think that the public have behaved magnificently in the way they responded to the government guidance, and particularly over this last Easter weekend with very unseasonably good weather, people have been very responsible and by and large staying at home as requested. I think it's very important for the government to give a clear and not a mixed message. So until we see the curve flattening, the rate of hospital admissions starting to come down, which will then lead in due course to the death rates coming down, we cannot relax the measures prematurely. So I think the government is right to stick with social distancing.
Yeah, no, that may be in fact what happens, but we've had almost a month of that. And what I'm saying is that people are very well aware of how to keep themselves safe, how to keep their friends and neighbours safe, and are, as you say, really complying admirably. So why not tell them about the exit strategy? Surely they have a right to know.
I think we can talk about the exit strategy and start to give messages about how restrictions can be relaxed once we're in a position to know that this can start to happen in a matter of days. If you give too much lead-in time, you're giving a mixed, confused message, and that will be very difficult for the public to follow.
Is it difficult for the public to follow, Clare Wenham?
I don't think it is difficult for the public to follow. I think we need to give the public more credit. People are intelligent. People can understand that this week we're still doing social distancing and stay at home, and next week things might change, or the week after, or whatever the exit strategy says. But I think this speaks more broadly to the Tory government's approach over the last few years of very simple three-word messages. Take back control, for example, and stay at home is a very simple message. And I think that's just the Tories' approach to doing this, rather than giving people the due credit they deserve.
We shouldn't really party politicise this, Claire. This was a clear message: stay at home. It's working.
Let's look at people are very well aware of what is happening around the world, and I want to focus on one area which could provide maybe a bit of progress, which is the question of masks. Now, we know that in Taiwan, population of 26 million, fewer than 1,000 cases, very few deaths. Right from the get-go, they wore masks. Claire, in terms of reducing transmission, slowing the spread, a simple cloth mask, washed at night, even reinforced paper, would it make a difference if everybody adhered to that idea?
So I think there's inconclusive evidence on this at the moment, so I don't think we should be rushing to do that. What I think it can do, however, is remind people about social distancing. If you're seeing someone in the street wearing a mask, you might, remind yourself that actually we do need to stay further apart. But I'm not sure from a public health perspective it's yet been demonstrated to be effective.
So, sorry, Philip Dunne.
WHO guidelines on this, Kirsty. So I think Claire's right on this point. It's not conclusive. Can I make a point on masks? I think we've heard from some of the social care providers in particular about the price increases that they're seeing from commercial providers. And I'd make a plea to the government, if I may, that VAT on visors and face masks and other protective equipment at this particular time should be scrapped.
Let's just stick with that idea that actually it's about preparedness, and actually it might be for a future pandemic, ideas such as you put forward. But the whole question of future preparedness, we weren't really prepared for this. There was a modelling exercise when your boss, Jeremy Hunt, was Health Secretary 2016. And it showed that there were shortages, that we just didn't have either the ventilators or even, I would hasten to say, the PPE that we absolutely needed. Should we have moved faster? Was that a mistake?
Well, we've had a pandemic stockpile in case of pandemics, and that was what was one of the things that was tested in 2016. Undoubtedly, with the benefit of hindsight, had we known that this was going to be a global pandemic, which was going to be of unprecedented scale, we would have done something differently. But we've not had a pandemic of this order for 100 years, and to prepare on the off chance, if we would have to do so again, I'm sure we'll learn lessons from this. But I don't think the steps that were taken following the routine testings of the NHS in coping with pandemics affecting this country, that we would have done things that differently. Clearly, lots of things have come about in terms of distribution, and one of the things that Matt Hancock has arranged since he's taken charge of the NHS response to this has been to introduce a whole new system of distribution, mobilising the military to help get kit to the 58,000 different healthcare settings, including social care, right around the country.
Thank you both very much indeed.